a big predominant factor was the fact that like a partner had to say, hey, something's going on. Like a partner had to say, hey, I feel like you like stop breathing, right? Someone had to kind of witness the event, right? But what if you're in this instance where you don't know, like, or let's say you stay by yourself and no one could witness these things, right? So these are some of the myths that I want to help kind of break up, especially for those people who may not have a saving grace, like a partner who can kind of witness and say, hey, I think something's going on. You might need to get that taken care of. Do you know that 80% of people with sleep apnea don't even know it? It almost sounds like like one of those hypertension stats, right? Like where almost like half the people with hypertension don't even know it. But yeah, that is true. About 80% of people with sleep apnea don't even know it. And I know it's true, right? Because when I saw a lot of the comments from a lot of my recent videos talking about sleep apnea, this seemed to be a very common theme amongst the comments, right? Like, I didn't even know I had it, didn't know it was that bad, or like they would have certain myths or mistruths that they've heard that they thought, all right, if this is it, this has to be sleep apnea, or if this is it, this is definitely not sleep apnea, right? So today we're going to be diving into some of the common mistruths or myths that leave people tired, frustrated, and really just not getting a good night's sleep because they're missing the fact that they do have sleep apnea. So what I want you to do before we get this started, right, I want you to this is the question I pose, right? If you ever thought that snoring, like your partner snoring, you snoring, could mean something a little bit more serious, I want you to comment yes in the comment section, right? Just let us know if you thought snoring was, the end all be all, right? If I snore, it's bad. If I don't snore, it's all good, right? Just comment yes, I thought that, or no, like I know that, snoring could mean a lot more, or not snoring doesn't mean that I'm all out the woods, right? So I'm very excited today to talk to you about sleep apnea, right? And we'll even talk a little bit about a personal story on how, especially when I was in outpatient medicine, taking care of a patient who didn't know they had sleep apnea and it almost cost them his life. All right, so first of all, let's talk about what makes sleep apnea so difficult, so tricky to recognize, diagnose, and get properly treated. When I think about sleep apnea, and when you hear about sleep apnea, especially on TV, the most common thing you hear about is the snoring. And we're going to get into some of the myths later, but the most common thing you hear about is that snoring, and how someone is a terrible loud snorer, how like you have to go to sleep before this person, because if they start sleeping first and get that snore, like no one in that house is sleeping, right? That's typically what you hear about when we talk about sleep apnea, right? Because they always want to equate it with the snoring. And I want to kind of give that little pushback to say like, hey, let's think about it a little bit more outside the box, because if we don't think outside the box, we're going to be, again, left with a lot of people, again, just judging my comment section, left with a lot of people who will be thoroughly surprised when they get those results back and realize like, wow, I got sleep apnea as well. So let's talk about this. And I've talked about this on previous episodes before, where I had this patient I was taking care of in the hospital, came in for, I think, just routine, I think chest pain. I think it was like chest pain. And at nighttime, I was the nighttime physician. Nighttime, I get a call, hey, doc, you need to come to, room 312. It's not an emergency, but like something's wrong. So I go in there, and before I get to the room, she says, hey doc, I want you to look at the telemetry monitor, right, which is kind of the heart monitor. And you could see this person's heartbeat essentially stop for seconds and then kind of start up again, stop completely. And I'm not saying like beat, go slow, and then come back on. Like, no, it stopped, no electrical activity whatsoever, then came back on again for a significant amount of time. So, but when we go to the room, patient is like sleep, like patient is like comfortably asleep. But one thing that is predominant, patient is snoring. And this is a bigger, heavy set guy. He's snoring out the wazoo. But when he would do one of the and then kind of stop breathing, aka stop snoring, and that little pause almost correlated 1-to-1 when his heart would stop. So okay, we woke him up, we ended up calling like a rapid response, woke him up, said, hey, I just want to make sure everything's okay because like your heart is stopping. He's like, no, doc, I feel great, right? He was completely oblivious why his whole room was full with people who were staring at him, wondering if everything was okay, right? Because again, once that happened, we're calling rapid response. Everyone's rushing to the room, and he's like, what? Like he's kind of disoriented because he doesn't understand why his room is now filled with a whole bunch of people and crash carts and everything. So we clear that, let him go to bed. Probably an hour and a half later, I get the same call, same nurse, same rapid response, same reason. This time we're like, okay, yeah, this is going to be an issue, right? So I ended up calling the cardiologist. I showed the cardiologist, hey, this is what we're looking at. This is our concerns. Over the phone, cardiologist says, hey, you know what? This is a big, heavy-set guy. Is he snoring? Yes. I think he has really bad sleep apnea, and we're probably going to have to put a pacemaker in him. And I was a resident at the time, so I'm still kind of confused because like I was just calling because this guy looks like he has some type of heart block when he goes to sleep, and the cardiologist is like, yeah, he probably has sleep apnea, right? So it was one of the first times that I was introduced to the fact that, oh, this sleep apnea is very serious. Like it isn't just a snoring person's disease. This is a very serious issue. And of course, like true attendings style, like I had to do a whole presentation on sleep apnea and the effects on the cardiovascular system because this is what our attendings do, right? So that was my introduction to this topic of diagnosis. And again, throughout the years, I've had friends, family members be diagnosed with sleep apnea. I've actually been diagnosed with sleep apnea, had to get on a CPAP machine. So I recognize like, oh, yeah, this is definitely a disorder that I do not want to mess around with or play with because I understand the serious effects of not treating it appropriately, not doing the things I need to do to make sure, right, that like my heart doesn't stop in the middle of the night, right? Thank God for me and others, that has not been the case. So why does this condition fly under the radar, right? Again, 80% of people are walking around with sleep apnea and don't even know it, right? So why is this condition kind of flying under the radar? And why is it happening to so many people? And more importantly, what are some of the myths that are keeping us in the dark, so to speak, right? Pardon the pun, right? In regards to sleep apnea and, not only being not diagnosed, but being not being treated, right? When I was going through a lot of our comment section, a big predominant factor was the fact that like a partner had to say, hey, something's going on. Like a partner had to say, hey, I feel like you like stop breathing, right? Someone had to kind of witness the event, right? But what if you're in this instance where you don't know, like, or let's say you stay by yourself and no one could witness these things, right? So these are some of the myths that I want to help kind of break up, especially for those people who may not have a saving grace, like a partner who can kind of witness and say, hey, I think something's going on. You might need to get that taken care of, right? So I definitely want to make sure we piece that together because I think it is important when we're talking about some of these myths, right? Because I think once you understand and hear some of these myths that, again, are common and peppered throughout not only my comment sections, but just people's psyche in regards to sleep apnea, you will understand how 80% of y'all will walk around here with it and deal with all of the side effects and issues with uncontrolled sleep apnea or untreated sleep apnea and not even know it. All right, so I think before we get into kind of some of our myths, right? So again, these are just common mistakes that I think a lot of people fall into when they think about sleep apnea. One, that being tired is normal. There are a lot of people who just think that like, I had a long night, I was studying, I was working, they always have a reason why when they wake up in the mornings, even after, a fresh cup of coffee, they are still tired. Understanding that, yes, stress affects a lot of people. Yes, stress can affect your sleep, but the likelihood that stress is causing you to, again, feel tired, feel weak, gain weight, not being able to control your blood pressure and all these other things here, top of having a bad night's sleep is kind of low, right? So yes, there could be a lot of people are in stressful situations, right? Just look around. A lot of stressful situations going on, but we can't just chop up that stress is the reason why, like I'm feeling the way I'm feeling, right? So again, these are just common issues, and then this is a big one, right? I'm too young or too healthy, right? In my comment section, there are a lot of people who felt that they phenotypically did not fit the picture of what a person with sleep apnea was, right? Like, because again, when you hear about sleep apnea, not only do you think about the person who's a big snorer at night, keeping the whole house awake, but you think about obese, smoker. You just have these mental pictures, male, right? It's a big one too, right? Because there's a lot of women in my comments who were shocked that they might have had it, right? Like, yeah, like a lot of women have it as well too, right? So they have this general picture, almost like if you watch South Park, like Cartman, right? They think like the person who has sleep apnea kind of looks like Cartman. And that's oh yeah, that's the typical sleep apnea person. So when they don't look like a Cartman, big, round, heavy set, big neck, they think like, oh, like it can't be me. But that is further from the truth, especially again, like I said, when we think about 80% of y'all walking around with sleep apnea and don't even know, right? So in a moment, we're going to reveal, the first of many myths to talk about sleep apnea, to talk about this aspect of certain myths that we have to kind of delete from our dictionary in our minds, so we can make sure that we can not only recognize it in ourselves if we are dealing with it, but more importantly, recognizing it in others, right? Like I said, it took me some years, right? Like I said, I was a resident. Again, I've been a practicing attending physician for over a decade now. When I was in residency, we're going on almost 12 plus years since like that diagnosis of sleep apnea in that patient who, it was just sleeping. And thankfully, like we caught it because we just happened to be monitoring on this telemetry monitor, right? But I always think about, man, imagine if for some reason I admitted this patient and I didn't put him on the heart monitor. And all I did was look at him as like, oh, look at this guy. He sleeps, he snores, and that's it, right? Like there's a good possibility he is likely not. And I don't see, like I said, I haven't seen the guy. I haven't seen that patient in like 12 years. So I'm assuming this patient's still around, but there's a possibility that if I did not put this person on a telemetry monitor, if we weren't monitoring his heart issues, just because he happened to came in with, I think, chest pain. If we weren't monitoring his heart rhythm, there's a likely high chance that we discharge him that morning and we don't put a pacemaker in him before he leaves, and he could have ended up having full on heart block, meaning that the heart essentially stopped in the comfort of his own home, right? And that would have been something that we missed, right? So this is a diagnosis we don't want to mess around with, and we don't want to miss, so to speak, for sure. All right, so let's break down some myths associated with, right? This is what we've all been waiting for, right? What are some of the most common myths associated with sleep apnea that we do not want to, again, pardon the pun, sleep on, right? To make sure that we're not missing this diagnosis that is affecting 80% of the people, right? And again, if you're enjoying the topic or the conversation, make sure you hit the like button, you hit that subscribe button, hit that notification bell button so you are always up to date on what's going on here at with Medicine Mondays and Dr. Barry Pierre TV. So with myth number one, only overweight people, again, I had to start out with this, right? Only overweight people and older men can get sleep apnea. Further from the truth, right? Again, not only does it affect women, it can affect children, especially at an age where teenagers, they're getting heavier, they're getting bigger, right? They work out, like big neck, so children can be affected. All body types can be affected. More importantly, especially for my women audience, postmenopausal women seem to have an increased risk of developing sleep apnea, for a myriad of reasons, right? I think, and I say this all the time, estrogen is one of those hormones that is like a super hormone in that it is very protective of our women. But what happens when they're postmenopausal and those estrogen levels start to decrease, guess what? There are a lot of risk factors that they weren't like at risk for, that they start becoming at risk because their estrogen level isn't there to kind of protect them, right? So being overweight or being an older man is definitely a myth that we need to get out of, right? Like, yes, you can be a woman, you can be a child, you can be skinny, you can be fit, you can be a gym rat and still have sleep apnea. Number two, if I do not snore, I'm in the clear. Think about that, right? If I do not snore, I'm in the clear. This is a big myth associated with sleep apnea. This is a big reason why a lot of people won't get the diagnosis, right? Like when they do the sleep apnea test, they will fit like yes for like every single question except the I do not snore. Now, sometimes what happens, they don't have a partner, so there's no one to tell them that they snore. But let's say they do have a partner, maybe they don't snore. Maybe anatomically, everything looks good where they don't have to snore. No, that does not mean that you don't have to worry about having sleep apnea, which again, further from the truth, right? Up to half of people with sleep apnea do not snore. Let's make sure we get that. Up to 50% of the people with sleep apnea do not snore, y'all. So again, when I say like you having a snoring issue or not doesn't get you out of jail as far as sleep apnea, this is true, right? Again, up to 50% of people with sleep apnea do not snore, right? So big one to understand. Big things we like to look for, and I'm a big symptoms person, right? When I take care of patients in a nursing home, rehab facilities, long-term care facilities, certain hospitals, and quite often I see when I get a phone call from nursing staff, a lot of times they're very fixated on the numbers. Oh, hey, the blood pressure is this, the blood sugar is this. Should we do A, B, or C? And one of my most common questions, and like I said, because I know a lot of my nurse colleagues follow me on the channel, right, and listen to the podcast. I'll ask them and say, hey, is there any symptoms, right? Because I want to know, like, yes, I understand you're giving me these numbers, but is there any symptoms? And that's something that I got from my attending, right? My attending was big on, like, I don't care what the numbers say. What does the person's body say? What do the symptoms say? Like, they were big on that. So is the symptoms there, right? So understand daytime sleepiness, trouble concentrating, headaches, waking up, mood changes. Think about that, right? A lot of people have very big mood swings associated with their inability to have a good night's sleep, right? So mood changes are a big one. So again, if you don't snore, that does not mean you are in the clear, right? Myth number 3, CPAP is the only answer. This is the big one, right? The reason why I want to say this is because I think a lot of people have little secret beef with the healthcare system, little secret beef with doctors, right? So they always think that when we present a problem like sleep apnea, we're only doing it to sell you a product like the CPAP machine, right? And I got a lot of comments that like, oh, you don't even need a CPAP machine to take care of your sleep apnea, right? And guess what? The answer is you are right. Yes, you are right. You don't need a CPAP to take care of all types of sleep apnea. Now, that being said, a lot of y'all do need CPAP. A lot of y'all will likely need a CPAP machine, but no, it does not mean that 100% of people who have sleep apnea will need the CPAP machine. That is just not true. Again, it is highly effective. Again, other options, lifestyle changes, the thing that they swear us doctors never recommend, lifestyle changes, right? Again, for myself, not only did I have to deal with my sleep apnea, but I had to work on weight loss, right? I had to work on weight loss. I had to work on sleep hygiene. There are a lot of things I have to work on to improve my stance dealing with my sleep apnea, right? Because again, CPAP machine is there, but again, if I don't do the other issues and things I need to work on, it's not going to matter. Dental applications are available. Certain people may need surgery, right? And especially when we talk about sleep apnea, a lot of people understand and really will focus on the obstructive aspect of sleep apnea, right? Like I have an obstruction that's causing my sleep apnea, right? But there's a different type of sleep apnea called central sleep apnea that actually happens in the brain. And the brain is causing kind of the same similar issues to occur, but it's not like an obstructive process, right? So again, understand there are different options and treatments associated with sleep apnea. CPAP machine just happens to be one of the gold standards, but yes, it is not the only one, right? Because I don't want people to be like, well, you're just trying to sell us a CPAP machine, right? Like as if I have a CPAP machine in my Amazon list, right? Now think about it. No, I don't. I'm joking. Not joking. No, there's no CPAP machine in my Amazon list, but I do have Amazon list. It has my list of supplements that I always recommend people should get, right? You should check that out. Link will be in the description. Myth number 4, losing weight cures sleep apnea completely. This kind of follows along the lines of our number 3, where we talk about the CPAP machine, like cure sleep apnea. Part of our lifestyle changes, yes, we do focus on losing weight, but yes, it is not a guarantee to just deal with all of your sleep apnea. So yes, it does help. Yes, it can help, but it is not the cure all, especially when we talk about obstruction, hygiene, maybe some illicit, alcohol or any other things you may be taking that could be adding to the sleep apnea. So understand that yes, losing weight can help with the sleep apnea, but it does not cure the sleep apnea. Hope we all get that. So myth number 5, kids cannot get sleep apnea. Again, I would love to say that, oh yeah, if you're under the age of 12 or 14, you don't have to worry about sleep apnea. Unfortunately, that's just not true anymore, right? Children can absolutely develop sleep apnea. It's typically associated, remember we talked about the obstructive aspect of it, in large tonsils, in large adenoids, and it could show up in kids who are hyperactive. Just like adults, when adults don't get a good night's sleep, they probably are not gonna have a good day at work. When kids don't have a good night's sleep, they're probably not gonna have a good day at school. They're hyperactive, they are bedwetting, poor performance on grades, right? So think there always is a possibility, especially when we think about kids, of having sleep apnea, and especially because we were talking about the obstructive aspect of it, that does the same symptoms, but just in a child, right? Like I said, the child's not going to spaz out at work because they don't go to work. But guess what? They may spaz out at school, right? And have these issues that tend to occur. So think about sleep apnea and affecting children. Yes, that is a possibility that can occur. So this is a big one, right? Taking action, right? You know me, I'm a big empower yourself for better health, right? Shout out to the motto, empower yourself for better health, right? So how do we take action? What are some of the action steps, right? Again, I'm a big thing on sleep, keeping that sleep diary, understanding when are you tired, headaches, nighttime you're waking up. That's a big one. Talk to your doctor, right? Either talking to your primary care doctor. If you have a sleep medicine specialist that you follow, talk to them as well. That's a big one. Try to be healthy. Sleep hygiene is a big one. And again, understand that, especially for those who get put on the CPAP machine, right? Because that was a big thing that I saw in the comment section, that there are people who got started on the CPAP machine, but it just didn't vibe for them. It was something about it that just didn't vibe for them. So understand that yes, you can have sleep apnea. You can be put on a CPAP machine, right? And maybe the first rendition doesn't go. Maybe the mask doesn't fit. Maybe the settings aren't correct, right? So there are a lot of different things you need to work on. So it isn't a one size fits all. And it is a lot of times kind of trial by error. Like you're just kind of working through the kinks until you kind of find a great happy median in solving your sleep apnea, right? Because it is a puzzle that you and your provider need to help solve. All right, and again, before I tap out of here, I want to address some of the pitfalls that are associated with sleep apnea. And this is going to be kind of a review from some of our past videos. So if you hadn't had a chance, please check out a couple of our past videos on sleep apnea, because I think that'll give you a nice little. This one we're not necessarily talking about the pathophys associated with sleep apnea. We do a little bit better job on the past videos, so you can check those out if you want to kind of know the pathophysiology associated with sleep apnea. But these are just kind of us getting these myths up out of here. Pitfall number one: if I tough it out, it will go away. Definitely not true. Number two, mouth guards or nose strips from the drugstore are enough. No, right? Again, like I said, it's one of those things where can it be additive to the treatment armamentarium? Yes, right? But is it the end all be all for most people? No. Again, it's the reason why 80% of y'all have sleep apnea and don't even know it, because you guys may inject a myth that you think like, oh, I just threw a nose strip on there, I'm good to go, right? And that's unfortunately sometimes not the case. And this is a big one. Now, this used to be true. I'll put this myth as half true, half false. CPAP machines are all noisy, big, and uncomfortable. When I started, again, when I bring it back, 12 plus years, and I first started taking care of patients with sleep apnea, this was 100% true. You'd have a CPAP machine that you could hear throughout the house. They were loud, they were clunky. The masks were like these one size fit all, so it didn't matter if you were a mouth breather, nose breather, you had one mask and you just had to deal with it. Fortunately, that is no longer the case, right? So this is a myth that used to be true, but is not true anymore. This is no longer the case. You can have a CPAP machine. Someone who is your partner cannot have sleep apnea. You can turn your CPAP machine on, and your partner would never even know it. It's a little, because mine's is like a little small little box. It's right next to my bed, and your partner doesn't even know the CPAP machine is on. Like, it is that quiet. We have nasal masks now for the people who just breathe through their nose. We have obviously the ones that cover the mouth, right? So lots of different options available now that were not available beforehand, right? Because again, I don't want us putting off these concerns, right? I don't want us being able to be like, yeah, I got sleep apnea, but it's not that big of a deal. It's because that's totally false, right? Again, it can be dangerous. I talked about our patient in the hospital. He was having like a second degree like heart leak. He was having a heart block, right, where he needed a pacemaker. Almost had to get defibrillator, but thankfully he only needed a pacemaker. We could have a whole episode on the differences between those two. But you can risk a stroke, heart failure, uncontrolled diabetes, uncontrolled weight are all factors associated with people who have uncontrolled sleep apnea and don't even know it, right? People who are irritable, mood changes, they're just angry when they come to work. possibility they have sleep apnea. I don't want y'all going to work telling all the people who looks like they're having a little mood swing, like, hey, make sure you don't got sleep apnea. I don't want y'all doing that, right? Send them a sleep apnea questionnaire if you think they have sleep apnea. But and like I said, there's no look no more, right? So I don't want y'all to think like, all right, this person looks fit, a little skinny, like small neck. And the reason why I mentioned small neck, because one of the questions in the questionnaire as far as sleep apnea is neck circumference, right? Because that is association with obstructive sleep apnea. So I don't want you all to think that the person who is opposite of that doesn't have sleep apnea, because that, again, is still true and still possible. So understand that getting control of sleep apnea isn't just about getting better sleep. It's about getting better control of your blood pressure, getting better control of your diabetes, getting better control of stroke risk, heart failure risk. It's about controlling a lot of other things on top of the sleep apnea. So yes, we want to get in control of your sleep apnea. Yes, I want that to happen, right? I want you to be on a CPAP machine. I want you to have the correct mask. I want you to have a great night's sleep, wake up refreshed. Because a common thing, again, I want you to just check out that comment section. A common thing that people will say is that the first night I was able to sleep with my CPAP machine was one of the best nights of sleep I ever had. Like, they can't imagine how they were sleeping before, because they just notice a difference. And it's a thing. Imagine, again, if you're hypoxic, which typically happens when you sleep apneic, so you're going through periods of like rest, you're going through periods where your body never gets to deep sleep because you're always having to wake itself up. Because you're hypoxic and your oxygen levels are going low, and all of a sudden now you get into that deep sleep and you're able to stay in that deep sleep. All of a sudden, that sleep feels and hits a lot different. All of a sudden you wake up, you're ready to attack the world in the morning, right? So understand that, yes, we aren't just here to tell you get your sleep apnea under control because we only want to get your sleep apnea controlled. We're here to tell you that because we know if we do these things, your heart failure risk decreases, stroke risk decreases, blood pressure somehow is better controlled, weight somehow being lost a lot easier, right? All of these things tend to matter if we deal with the big dog, which is that sleeping giant of sleep apnea. All right, so today we're going to recap, right, just to make sure that we got all of our myths up out the way. Anyone can have sleep apnea. Old, not just overweight, man. Anyone can have it. Snoring isn't the only issue associated with sleep apnea. CPAP machines aren't the only options for sleep apnea. Weight loss alone will not cure it. Yes, you could be a child, right? Yes, your kids can have sleep apnea, especially for those, again, talk to a pediatrician, right? Large tonsils and adenoids can definitely put them at risk. Ignoring it will not make it go away. So again, understand that, like, hopefully we're able to kind of get these myths up out of there. My job, again, like I said, is to help kind of bridge the story arc of sleep apnea and this, like, how bad it is. Because again, a lot of people are very concerned about it, right? Again, it's one of our, especially on our YouTube channel, right? It's probably one of our most commonly viewed videos, right? In this topic of sleep apnea. Right? Obviously, I'll put the link in the show notes for this CPAP machine, the sleep apnea episode everyone keeps watching, but understand that it is very, very important when we're trying to get ourselves better, right? Remember, empower yourself for better health, and it starts sometimes with having a good night's rest. I'm gonna see you guys next week.